Hi, my name is Susan Edlund Butler, and I am a BSN student with ECPI, and this is my senior practicum. I chose oral hygiene as my topic of choice, primarily because I'm quite fascinated with people's teeth and how they take care of them. I chose oral hygiene at my facility because I see very little oral hygiene being accomplished, and I'd like my staff to be more involved in providing oral hygiene to my long-term care residents. So I reviewed more than 10 research studies on oral hygiene, and I got permission from both my director of nurses and from the administrator prior to starting the research. My practicum mentor is a nurse practitioner in my facility, and she works for Optum Health, which is one of the insurance companies that do pay for oral care by a dentist and a hygienist twice a year. There's been many studies pointing to integration of dentistry into comprehensive long-term care settings, however, with very little success. So some of the people that I met with were the speech language pathologist, the social worker to collect the data related to the dentist that comes into our facility, and also the dietitian. The speech language pathologist shared that she was a little guilty at not educating our staff on the importance of oral hygiene, because of course she performs oral hygiene both prior to and after she does any therapy with our residents. She doesn't really see very many of the residents on long-term care unless they're experiencing choking while eating or increased coughing when they take medicine. She primarily works with acute rehab patients. But, you know, she was willing to participate, and she did send me some research. Unfortunately, it was too old for me to use, but she is willing to come in and speak on behalf of her profession when I give the PowerPoint presentation. I spoke with the dietitian, and she did talk to me about the importance of oral hygiene, weight loss, and we spoke about the amount of sugars that are in Ensure, because when a resident drinks a container of Ensure, and each one of them contain between 20 and 25 sugars, they're not getting oral care. So consequently, all that glucose is sitting on their tongue and growing microorganisms or biomass, which can actually break off and go into the lungs and cause aspiration pneumonia, which is one of the leading causes of death in long-term care facilities. I reached out to the dental office that manages our facility and asked them what their experience has been in the past. And rather than pinpointing us as a long-term care facility, the manager spoke broadly about their experience in general at long-term care facilities and how there's very little interaction between their dentist, their hygienist, and the local staff, because the local staff, of course, are always trying to get people up and dressed and washed and ready for the day. So she said that once they come into the facility in March, we can talk about some in-services that her hygienist could provide to our regular staff, and some handouts that she may have also. At least she was agreeable to that. So we're going to start a study on March 1st, and I'll tell you more about that later on in the slide. staff and studies. Many studies have been conducted covering oral health in long-term care facilities, but it doesn't appear that oral hygiene has improved over the years. Many of the studies recommended employing a dental hygienist as part of the interdisciplinary team. In our case, we would share one between two buildings. What a dream. Staff have very little time available to perform oral hygiene, or so they say. Once we get started on the study, March 1st, we'll see how that works out, because many of the residents could actually be set up with toothbrush, toothpaste, and so forth, sitting either in their wheelchairs or at the bedside. So, excuse me. And that's something that I'm going to have to go over with them. Most of our care plans are very generic, so I've started updating and individualizing each one. There are 66 of them, and I've probably gotten through about 10 so far. My husband and I have put together 66 hygiene kits, one for each resident. So each CNA, there's 3 on each unit. They have 11 residents apiece. They'll take their kit back to their 11 residents, because we're expecting the survey team to come in very shortly. And CMS has now got guidelines as far as oral health is concerned, and they can exact revenue if patients, if long-term care residents go into the hospital for aspiration pneumonia per se, because it is avoidable. But, you know, as I said, the biomass can break off of teeth and go into the lungs, and hence you have the aspiration pneumonia. I have prepared a PowerPoint presentation for my staff. It's probably a little bit too comprehensive, but I want to give them as much information as I possibly can so that they can believe that oral hygiene is important in the long-term care setting. It also covers nursing education and CNA training. So I'm actually looking forward to doing that. I did studies and oral hygiene audits on 5 residents, and I chose residents that actually had their own teeth, because yes, there are many residents that don't have any teeth, but they also don't have any dentures, and so it really felt like it would be null and void for me to do that type of thing. So, and it was hard for me to get the residents to tell the truth about their CNAs. But, you know, I can't punish anyone because we've never held them accountable before. I gained weights on 5 of them, so on March 1st, we know what our baseline is. There isn't any additional revenue generated from insurance companies for oral hygiene. However, as I said, it does affect revenue being taken away if somebody's in the hospital with aspiration pneumonia, and it could possibly affect the star rating of the facility. And CMS has new star ratings, and we currently only have 2. It would be nice to be 3 or 4, and that would be the goal. Insurance coverage has increased over the past 24 to 48 months for coverage, where residents can be seen twice a year by the dentist and the hygienist, which is a huge plus. So the summary of my experience overall was pretty positive. The staff and the residents felt chuffed that they were contributing towards my education. So I'm very grateful that I had the opportunity to complete this practicum. I appreciate any feedback. Thank you.